Imagine a world where you're doing everything right and we have technologies to individualize care, to understand you better, and come up with a customized healthcare plan and recommendations where you live long, happy life. And you are not held to one size fit all healthcare system, which is the contemporary reality. Welcome to this podcast. We will be discussing in detail about precision medicine. We'll take up the issue what precision medicine is, what kind of testing can be done during precision medicine. Then we will discuss its clinical applications, ethical questions, cost, and finally we will draw conclusions in current healthcare paradigm where this system fits. Let's start with the bigger question: what is precision medicine? In precision medicine, we understand or we interpret your genetic code believed to be written by evolution. But we have a blueprint and we could read whole blueprint, part of the blueprint, or specific parts of the blueprint. And then when this blueprint start manifesting in terms of molecules, which we call biomarkers, which may be good in circumstances, many times they may be bad, but once we can understand them, we could interpret this work so precisely that we could interpret and understand what diseases you may develop in future or what diseases are already manifesting and what we could do to prevent it. And God forbid, if you have a disease, what are the biomarkers which are available to target treatments? It is a fascinating time to be alive. Healthcare has gone through its evolution, and I think we are reaching the zenith of its evolution. In healthcare, we started about centuries ago where wise people had observational data. They understood the weathers, they understood the habits, they understood our eating pattern, lifestyles, and they start building up story or concepts where we understood that if we do this will happen, and they came up with natural treatment, herbal treatment. In last 75 to 100 years, medicine has made significant improvement with new technology, with medications. Now the care which is delivered, which I call contemporary medicine, is evidence-based, but it is not individualized. Every individual is unique even though we all are same. With precision medicine, we will be able to understand our genetic code and how this thing makes us unique. So, from ancient wisdom of observational science to contemporary medicine at this time, which is evidence based, reproducible, to futuristic medicine, which we call precision medicine. In precision medicine, we could understand or interpret your whole whole genome, your whole DNA, which is the blueprint which will manifest in terms of different diseases, some physiological improvements. And so we could understand your whole genome, or we could understand part of your genome. It is estimated that a very minute fraction of your total genetic makeup has genes which we know currently are coding for proteins and chemicals which run our body. Most of it is not fully understood and we call junk DNA. There is a lot of research in junk DNA field, and we know that junk DNA is not there as a junk, but we do not understand, and the term has been given junk DNA. But out of that active DNA, we could understand only part of the DNA which we need to understand. Say, for example, in case of BRCA gene 1 and 2, and multiple other examples we will take up. So we could understand, read your whole genome, part of that, And out of that active genome, we could even hyper focus and look at further smaller parts of it. In precision medicine, we could understand your genes, what your environment is doing to you, and what your lifestyle is doing to you. Say, for example, if you eat wrong, don't exercise, smoking, what kind of damage this thing is doing. So it is adding a lot of predictive value to precision medicine. That is going to revolutionize healthcare. We are improving every day. Every 3 weeks, the amount of medical information which is coming up is almost doubling. We are understanding people, diseases, medications a lot more better than which we ever had the opportunity to do that. So we are in a beautiful time where we will continue to improve. Next fundamental question comes in is, how does precision medicine differs from traditional medicine? In traditional medicine, which is the basis for precision medicine, as Newton said, if you want to look high, stand on the shoulder of giants. That's exactly what we are doing, from observational ancient science with the natural treatments to current contemporary medicine, which is evidence based. When the studies are done for the disease processes, those are not individualized. That's a herd or a community or a country or a cultural or a racial specific data which we have. Even among these categories, we all are different. So there is a more refinement. I just don't want anybody to have a feeling that current medication system is bad. I think the current medication system is perfect, and it delivers about 90% of the care which is right on target. In certain diseases where we need precision, that's where it will come. So precision medicine is in which we understand your genome and know you uniquely, who you are. And we could tailor-made treatment. We can understand what diseases you will develop. We could diagnose them early. We could treat them with the specific targeted therapies. And also, we will be able to prevent a lot of your medical problem as we go along. So precision medicine is an advancement over contemporary medicine. Also, in traditional medicine, we give medications without knowing how your body will respond to different medications. We know for a fact that every human being metabolizes drugs differently. Now, with precision medicine, we could predict and we will be able to give you a lot of targeted therapies. So, putting it together, what we test for genetic testing, which we have discussed, that we could understand your whole genome, part of the genome, or hyper focus in certain special interests. Then we could understand your physiology, how your body is metabolizing certain drugs so that you don't get side effects. And we give you only those medications which will be working for you. And if, God forbid, you develop some disease, we could target the therapy through biomarkers, gene editing, and we could risk stratify you, we could predict you, and hopefully we diagnose these diseases early and deliver personalized care. Let's take up what are the different kind of testing we do. The first is when we are understanding your genome, we could have your whole genome sequenced or part of it, which we call exome sequencing, or a very special part of it is, which is single nucleotide polymorphism. And the examples which we all are aware of, BRCA1 and BRCA2, and then certain genetic diseases like cystic fibrosis. As I alluded, we could predict how you're going to respond to different medications. Where I believe precision medicine will make biggest change in healthcare paradigm is predicting or preventing the diseases. Any kind of abnormality in a system starts that the gene mutates or changes, either due to some problem of its own or due to our bad habits, environments, or vices. We should be able to pick and find those places, mutations. Very clear examples are in case of lung cancer, breast cancer, melanoma, we and lot of immune therapies, we could find specific molecules and we could target them to diagnose and treatment. These biomarkers we are using currently. PSA test we have been doing it for last but almost 25 years. CA125 for ovarian cancer. Now KRAS mutation testing for colorectal cancer. We have been using troponins, which is a biomarker, to diagnose heart attacks, hemoglobin A1C, how your diabetes is. There is a lot of experimental things going on. Now we not only we could read your genetic code, we could edit it with CRISPR technology, and diseases which at one point were incurable like sickle cell disease and thalassemia, now they are fully treatable. We will be able to risk stratify based on these different markers. And as a physician, our ability to predict whether you are at high risk for heart problem, memory loss, or Alzheimer's disease, it is very, very high. Test which we are using currently in practice. Low dose CT scan for all smokers. We have been using it for a couple of years and now Medicare has approved it as a standard of care and you get it every year. Other beautiful thing will be the liquid biopsies. Now, if you have any kind of a tumor, that tissue needs to be cut out and then has to go to pathologist. It is painful, cumbersome, very boring process. Now, with liquid biopsies, we could take blood samples or other fluid samples and we could check for those biomarkers and we will be able to diagnose your treatment very quickly. People who have been suffering for allergies, their life have been hampered. Now we are able to deliver personalized immune therapy and they could lead normal life. The power behind this precision medicine comes from two places: artificial intelligence and big data. This should be discussed in detail. By connecting all the healthcare systems, we have a composite data which was not available. And then to understand it, sort it out, that's where artificial intelligence outperform human beings in a repetitive task. So it can develop beautiful predictive algorithms which not only will help us to prevent diseases, diagnose them early, but that also bring lot of ethical questions. Who are the custodian of this big data and artificial intelligence, and what is the role of an individual, governments, which we will take up in a minute. Let's now go through how precision medicine as we are talking today is changing. Cancer is a deadly disease, and in precision medicine, credit goes to immunologists and cancer specialists. They have really pioneered and they are leader in cancer therapy because cancer at the end of the day is a gene mutation where your those cells keep on dividing. They do not follow the role of being restricting themselves to their own boundaries. They not only overgrow, they invade other boundaries. That leads to metastasis, and that's how it kills. Oncologists are able to now understand a lot more genetic mutations which we could diagnose with precision medicine and can predict what will happen in future. Also, they know that when their gene mutations happen, certain biomarkers get represented on these cells. And when we have it, this gives us target sites to develop medications which will find those cells which are cancerous with those biomarkers, and we could direct therapies against them. The biggest improvement is in breast cancer. The ladies who are HER2 positive, they have a very good prognosis. Same with immunological markers. In case of lung cancer, melanoma, the list is ongoing. And I truly believe oncologists are the leaders in that. Second is our pharmacy. With precision medicine, we will know exactly which medications you will metabolize properly so there is no side effects, and which medication will work. And it is changing healthcare delivery model when you're taking blood thinners like warfarin, antiplatelet medication, antidepressant, and a lot of bipolar medications. So the side effects are minimal and you will be able to take care of yourself. If you have rare diseases, we could diagnose them properly and we could treat them. Precision medicine is revolutionizing the treatment of chronic medical problems. Chronic medical problems markers could be picked up quickly. Say, for example, cardiology. Only way to lower your cholesterol, we had statins, which are work about 99% of the time. But few individual people who cannot take it or this doesn't work, we are able to develop medications like PSK inhibitors, which will lower your cholesterol predictably, and you get injection once in every 6 months. There are some conditions in the cardiology like hypertrophic cardiomyopathy, long QT interval. There was no solution for them. Now we could diagnose them properly and we will be able to take care of them. In case of your brain health, Alzheimer's disease, seizure disorders, we could tailor-made treatment for you. Diabetes will be the biggest improvement. Now we will have a lot of predictive analysis done and we should be able to tell you what changes you need to make and make it quickly. Infectious diseases. That's where I think it will be very, very useful in acute care. Currently, if you get infection, we take cultures from the tissue or fluid from we believe the infection is coming from, or blood culture, urine cultures. It takes time to grow. And usually it takes 2 to 3 minimum before we could give you a final analysis that you have this particular infection and this medication will work. So technically, initially, you're getting empirical treatment. We are damn right most of the time, but the people whom we lose, that makes us wonder how many times we might be wrong. With this biomarker technologies, we should be able to quickly understand from those biomarkers which get represented on specific bugs, we will be able to diagnose them quickly and we will be able to take care of you properly. It has a lot of role in HIV disease and COVID management. Autoimmune diseases are revolutionized by precision medicine. Transplant, you matching people has been very difficult ordeal for the transplant teams. Now we should be able to understand everybody's genome and we will be able to help our patients significantly. In lung care, cystic fibrosis has been predominantly death sentence and it runs in a family. Now we will be able to understand it, have a proper marriage counseling, genetic counseling, and we will be able to take care of that. In case of pediatrics, we will be able to find the rare diseases very, very early. So we don't have to wait for those diseases to manifest and have end organ damage. Surgery is being sharpened with precision medicine. We believe it will be the future, how much to cut and where to cut. Mental health, because we could understand how medications will work and which medications will be effective and not effective, will be a game changer. In case of mental health, side effect of the medications is the biggest problem with any kind of treatment modality. If you're in a healthcare provider and you handle mental health patients, It's not the medication doesn't work. It is all about what not only doing what we want it to do, what it does. So side effects will be minimized, treatment will be very specific, and my hope is we will be able to focus it properly. Preventive medicine, that will be a game changer, knowing what will go wrong with me before it happens. Now we will be able to grow organs or part of the organs with regenerative medicine so that we could replace those parts which needs to be replaced. Precision medicine is going to change research and development. Currently, whenever the studies are done to check medicine, it goes through multiple different phases, phase 1, phase 2, phase 3, and each phase is upgrade from non-human to human, and then how much it can predict. With artificial intelligence and big databases could be understood and patronized quickly, and the drug research and development cost should go significantly, and the medications will be more precise as we will be able to understand the data in a holistic way. Medication research and development should fasten, and this is where our lawmakers have to really step in to ensure that the data which is presenting is correct and actually represent what is in the society. Initially, these all technologies are expensive, but as it happens with all technologies, we start very costly, and then as we do it more, technology improve, techniques improve, the cost of precision medicine should come down. But this will be a short-term challenge. Even today in healthcare, medications are getting better. We are able to prevent a lot of diseases, but unfortunately, medical economics is running behind. I think no discussion of precision medicine is complete without its ethical implications. The thing which is powering these improvements is big data and artificial intelligence. A lot of patients do not want their genome to be sequenced. Now somebody knows everything what will happen to them with the reasonable accuracy. They don't want to be discriminated. They don't want the insurance companies refusing coverage, and they don't want somebody making decisions on their behalf because of their genetics. Even with artificial intelligence going and up and improving every day, this is an ongoing debate in all communities. With precision medicine, the ethical considerations are data privacy. Then we don't want people to be discriminated because they were cavalier enough that they allowed their genetic data to be presented. And these technologies should not be restricted to rich people. We need to trickle down these technologies to average Joe so that we all benefit from that. For mainstream healthcare, change is difficult, and a lot of people are still dragging their feet. But this got to change because future is already here. We will be able to predict, diagnose, treat predictably and with minimal side effect. And that is healthcare utopia. How can we fight that? We will have challenges which we have to go through that. Future of precision health is bright. We have to work out the logistic, but the cost, ethical, and then big data and artificial intelligence. But we as a nation, as human being and Homo sapiens all over the world, we have always embraced technology and we have always used it for our benefit. So far, there has not been any technology which has been able to overpower us. I believe in our collective wisdom. I hope I was able to convince you that precision medicine is here to stay. It is the future. If we develop right habits to take care of our body, our emotions, our thoughts, our spiritual being, and our social environment, which translates to eat good, sleep enough, exercise daily, manage your emotions, have social relationships, and have some personal GPS which guides you how to act and react in this world. Coupled with precision medicine, you will grow. We have created a lot of videos on precision medicine. I think if you are here so far, you will like this video, and I will link in the cards above. I will see you in next video. This is Dr. Kulmeet Kundlas signing off. See you next time.